Good morning. My name is Stacy Duncan, and on behalf of the Tata chapter of Omega Psi Phi Fraternity Incorporated and the Compton alumni chapter of Delta Sigma Theta Sorority Incorporated, I am honored to welcome you to the 14th annual First Virtual Health Symposium. My chapter president was not able to greet you today, but if she were to do so, she would say with much enthusiasm, "We are great out of Compton," and I wholeheartedly agree. As a graduate of Charles R. Drew University of Medicine and Science in the adjacent community of Compton, I am so very proud to be a part of this event today. We all know that Charles Drew, a member of Omega Psi Phi, was a pioneer in medicine. He directed blood plasma programs in both the United States and Great Britain during World War II. But he resigned his position after a ruling that blood of African Americans would be separated from the blood of white Americans. Although this was decades ago, we continue to experience health disparities due to the color of our skin. With that in mind, this great event will attempt to provide insight with the goal of educating and providing resources to mitigate present-day health issues and concerns with the aid and input from organizations such as City of Hope, Options for Recovery, and the City of Compton. So with that said, it is my hope that you not only find this information valuable, but that it also aids you in your wellness journey. Thank you.
Hello, and welcome to the 14th annual Dr. Charles R. Drew Virtual Health Symposium, hosted by Tata chapter of Omega Psi Phi Fraternity Incorporated, Options for Recovery, the Compton alumni chapter of Delta Sigma Theta Sorority Incorporated, and the City of Hope. My name is Charles Ezell. I'm president of Tata chapter of Omega Psi Phi Fraternity. Omega Psi Phi was founded in 1911 on the campus of Howard University in Washington, D.C. Tata chapter was established in 1961 in the city of Compton, and for almost 60 years we have strived to live by our mission of transforming our communities through service and mentorship. This virtual symposium is named after the famed African-American surgeon, medical researcher, and Omega man, Dr. Charles R. Drew. Dr. Drew made groundbreaking discoveries in the storage and processing of blood for transfusions. He also managed two of the largest blood banks during World War II. Dr. Drew's legacy is why we are providing this forum to the community. And like source Stacy Duncan, I too am a proud graduate of the Charles R. Drew University of Medicine and Science here in Los Angeles. 2020 has been a year for the books. We all have had to make life-altering adjustments dealing with the coronavirus pandemic. We as an organization felt it was important to provide a forum that will impart valuable information to our community surrounding the medical, political, and social ramifications of COVID-19, and how do we steer through it effectively and safely. Once again, welcome to the 14th annual Dr. Charles R. Drew Virtual Health Symposium. I believe that you will find this event to be quite resourceful. I will now hand it over to your host, Bill Coleman.
Good morning, and welcome to the 14th annual Dr. Charles R. Drew Virtual Health Symposium, hosted by Tata chapter of Omega Psi Phi Fraternity Incorporated, in collaboration with Options for Recovery and the Compton alumni chapter of Delta Sigma Theta Sorority Incorporated. I am Bill Coleman. I'm a member of Tata chapter of Omega Psi Phi Fraternity and your host for this forum. For the next 2 hours, we hope that our panel of experts will provide you with vital information necessary to navigate through this new way of life, the COVID-19 era. So let's get started. Our first speaker will be Dr. Jabril Johnson, a biomedical researcher with the City of Hope in Duarte, California. After successfully acquiring his PhD at Howard University in Washington, D.C., Dr. Johnson began his training as a postdoctoral researcher at the National Institute of Health, National Cancer Institute in Bethesda, Maryland. He continued his postdoctoral training at the City of Hope Beckman Research Institute, also in Duarte, California. His postdoctoral training and expertise encompasses stem cell biology, impact of breast carcinogenesis, and the innate immunity impact on prostate cancer development. Dr. Johnson's accomplishments include higher education certifications, several publications in internationally recognized scientific journals, and a 2019 Harvard University New England Science Symposium Award. Dr. Johnson will be discussing how the coronavirus exploits people with underlying health conditions in underserved communities. With that, please let's welcome Dr. Jabril Johnson.
How are you all doing today? It's a pleasure to be with you all and speak with you all on such a serious condition that we all face today, the COVID-19 pandemic, the novel coronavirus bringing attention to existing health disparities. My name is Dr. Jabril Johnson. I'm a human molecular geneticist in the Division of Health Equities under Dr. Rick Kittles in the Department of Population Sciences. An outline of what we'll be talking about today. The next slide, please. Thank you. We'll be talking about the structure and composition of the coronavirus, an overall view of a virus life cycle. It is important to understand the impact of how a virus affects the cell in how we deal with the virus itself, how it is contracted, the possible organs that are affected, who is at risk for developing COVID-19, are underrepresented populations more at risk, what can be done to avoid infection, what can be done once infected, and conclusions. The structure and composition of a virus is very interesting because by definition, a virus is neither dead or alive. It is simply a microstructure consisting of genetic material protected by an envelope, a membrane, and spikes that protrude its surface, specifically the coronavirus itself. Now, this is very interesting as depicted with the picture to the right of the screen. You see the genetic material, which would be represented by the whitish ribbons surrounded by the membrane. And then you see the reddish spikes. This is something that is specifically for the coronavirus, which is how it got its name, corona, which is the crown, the spikes, right? And this is how it gains entry into the human host cell. But the coronavirus isn't new. In fact, 20% of all common colds are due to the coronavirus. However, new mutations enable the coronavirus to be more infectious and deadly. Thus, these new mutations created the novel coronavirus, which gives rise to COVID-19. So an overall view, which is very important to understand, is that a cell, which is the host cell, because again, the virus is neither dead nor alive, when a virus comes into contact with the cell, it must attach itself to receptors. Once the virus attaches itself to the receptors of a cell, it is absorbed and the cell is then evaded, right? And then the virus begins to uncoat and the proteins within the actual virus begins to unpack and the DNA and RNA material of the foreign virus begins to incorporate itself within the nucleus of the host cell. The viral machinery allows for the DNA of its own self to be replicated within the host cell. The proteins are then spread out and disseminated within the cell. The virus is then repacked and assimilated and then dispersed and disseminated to affect other cells. However, how is the novel coronavirus contracted? Well, it's important to denote that the novel coronavirus, or SARS-CoV-2, which is noted severe acute respiratory syndrome coronavirus 2, is contracted a couple of ways. Breathing in air that is contaminated with the virus, touching contaminated surfaces and spreading the virus to the orifices of the mouth, eyes, and nose. Thus, the novel coronavirus infects cells by using its spikes to attach to cell receptors known as ACE2, and we talked about this in a previous slide. So one of the receptors known as ACE2 has been prominent in scientific research thus far because ACE2 is expressed in the orifices of the epithelial cells that line the nasal cavity, in the nose, the mouth, and also the lungs, the cells that line the lungs, right? There are a myriad of cells that express, previous slide. Yeah. There are a myriad of cells that express ACE2, which makes the novel coronavirus very infectious and possibly deadly. And this is what's very important to pay attention to, right? So the next slide. When we first learned of the virus back in February, we assumed that the symptoms to be aware of were severe acute respiratory syndrome, such as problems breathing, problems with congestion, and fever. that was pretty much it at that particular time. We later learned that the virus had the effects of complicating other organs normally, okay? And this picture here shows multiple organs and the cells that line these organs that are affected based on ACE2 receptors and or CTSL receptors and temperance. But one thing that they all have in common is that all of these organs express ACE2, okay? So we have our nasal cavity, we have the lungs, the ileum and the digestive tract, the heart, the eyes, liver, bladder, kidney, pancreas, brain, prostate, and testes, and a placenta. Now, all of the symptoms that you hear of now make sense, right? You have your nasal cavity with your congestion, your headaches, you have your lungs with the problem of breathing, your digestive issues, you have your heart. Those that are hypertensive seem to be at a higher risk for being severely ill. You have your eyes, conjunctivitis, you have the liver failure, bladder issues, and kidney failure as well, so forth and so on. Next slide. People at risk or increased risk for severe illness due to COVID-19. Although 80% will present with no symptoms or be asymptomatic for COVID-19, there are a subset of individuals with increased risk for developing severe illness from COVID-19. Of course, we heard those of being the elderly and people with underlying conditions or pre-existing complications. In addition, per orders of the CDC, underrepresented ethnic populations need to take extra precaution. The question is why? Next slide. According to the CDC, there's a long-standing systemic health and social inequities that have put some members of the racial ethnic minority groups at increased risk for COVID-19 for experiencing severe illness regardless of age. There have been recent publications that from the Washington Post that gave credence and gave the spotlight to underrepresented populations and ethnic groups such as the African American community to be at high risk. Dr. Fauci admits that social health inequities exist within the healthcare within the United States of America that makes us highly disproportionately affected by the virus and the treatment within the hospitals when we actually go there to be treated with the virus, right? So this graph shows how disproportionately we are affected by it. Now, the underlying reasons behind these numbers are very interesting, and we can get into those within the Q&A session. However, what's important to see from this graph here, you have non-Hispanic American, Indian, or Alaska Native persons have an approximate rate. Previous slide, please. Finish. No, thank you. Have approximately 5 times the rate of non-Hispanic white persons. Non-Hispanic Black persons have a rate approximately 5 times that of non-Hispanic whites, and Hispanic and Latinos have a rate of approximately 4 times that of non-Hispanic whites when treated at the hospitals and being for severely illness or being severely ill from this, right? And that's very important to understand due to the fact that the hospitalization that we're talking about, from the 80% that are asymptomatic to the 20% that end up being in the hospital placed on ventilators, about half of those numbers end up either critically ill and or lethal and dead. So this disproportionate effect has to be addressed, and Dr. Fauci admits, and there has been recent data that shows the new treatment, new protocols for African Americans or underrepresented populations to help these numbers taper off so that there isn't a great disproportionate effect and a gap being seen as such. Next slide. What can be done to avoid infection? Well, first, know the fundamentals and how the virus spreads. Stay informed is very important. Watch the news nationally and internationally. Stay up to date with scientific progress on COVID-19 data. Wash your hands often. Keep hands clean. When using hand sanitizers, make sure that the hand sanitizer has at least 60% of alcohol content. Avoid close contact. Use procedural, surgical, and or N95 masks. with filtration and ventilation. Clean and disinfect properly. Monitor your health daily, which includes keeping the immune system strong, i.e., proper dieting, making sure that you're eating proper meals, vegetables, fruits, your fiber, and making sure that you stay up on your multivitamins. Vitamin D and vitamin C specifically, data has shown that vitamin D has been shown to have anti-inflammatory effects in the body and also antiviral effects in the innate immunity response pathway. Next slide. What to do once infected? Stay home except to get medical care. And this is something per the CDC, and most of your hospitals will tell you when you call them, they'll tell you to, if you have severe illness or if you have problems breathing, then you come in. However, if you do not present with those symptoms as being severe, then you stay home, take care of yourself within those the 2 to 3 week period. Separate yourself from others, quarantine yourself for 2 weeks to offset the time of exposure to virus eradication. Monitor your symptoms. This is very important so that you feel and know the difference from when you're simply having a low-grade fever of about 101.3 to a high-grade fever of 103, to call your doctor when that high-grade fever doesn't break. Call ahead of visiting your doctor. This is something that the hospitals prefer for their protocols so that you don't spread the infection to others that are in the hospitals, and therefore to protect yourself as well. If you are sick, wear a mask to protect others and yourself. Clean your hands often. Avoid sharing personal household items. For asymptomatic individuals or possible exposure, you can get tested at local facilities such as your CVS. So as a conclusion, the novel SARS-CoV-2 virus, which later develops into COVID-19, is very infectious and deadly. It is spread airborne by touching your mouth, eyes, and nose after touching contaminated surfaces. And although 80% of the population are asymptomatic, underrepresented populations are at increased risk for hospitalization. Therefore, due to underrepresented populations being disproportionately affected by underlying conditions, it is important to stay healthy. And we're speaking of these underlying conditions such as asthma, hypertension, obesity, and kidney disease, liver failure, so forth and so on. Following the steps to prevent and avoid infection is important. In addition, indulge in proper eating, exercising, and multivitamin intake, and staying up to date with your physician. If you feel that you are ill, quarantine and avoid others. Take care of yourself at home. Contact your physician if symptoms such as difficulty of breathing are present. Keep in mind, asymptomatic does not mean you cannot spread the virus. Data suggests that asymptomatic people may still be able to spread the virus just at low efficiency. This concludes my presentation, and remember, there is no profit in curing the body if in the process we destroy the soul. Thank you very much.
Let's thank Dr. Johnson for his skilled insight into the mechanisms of COVID-19 and how the virus affects people with underlying health conditions. That was a very impactful presentation. Before we go to our next speaker, I want to remind all of our attendees that if time permits, we will have an opportunity to ask questions in the Q&A section of the webinar. So later in the program, if you have questions for any of our panelists, feel free to put them into the Q&A section of the webinar. So let's go to our next speaker. Next up, we have Dr. Thomas Oden, an Atlanta-based board-certified psychiatrist specializing in psychotherapy, forensics, and integrative health, and a member of Omega Psi Phi fraternity. His interest in mental health began at Morehouse College, where he graduated with a Bachelor of Arts degree in psychology. Dr. Oden then went on to receive his medical degree from Boston University School of Medicine before completing his psychiatry residency and forensics fellowship training at Tulane University of Medicine. His integrative health expertise is centered in several forms of Reiki, a specialized type of alternative medicine called energy healing, In addition to running his own private practice in Midtown Atlanta, Dr. Oden is also an assistant clinical professor of psychology and behavioral sciences at Morehouse School of Medicine, where he teaches lectures in psychopathology, as well as a clinical skills training for medical students. Dr. Oden will discuss issues surrounding mental health, a major concern for people young and old adapting to this new world. With that, please welcome Dr. Thomas Oden.
All right, good morning, everyone. Thanks for joining in. We're going to talk about mental health and dealing with stress management during the COVID-19 pandemic. About 10 minutes, so I'll squeeze in as much as I can, but I'm really happy to be here. We can go to the next slide. Thanks. So we know that pandemics are very stressful, and this is a really good time to take inventory on your mental health. I work on a platform called Teledoc that allows for patients in various states to access care at home. And so I work in California often because I have a state medical license there, but I also work in Georgia, Louisiana, and New Hampshire. And so, you know, due to regulations being a bit lowered when it comes to our ability to offer psychiatric assistance to patients using technology, it's a really good time to try to access platforms like that. But pandemics are very stressful. We're still in the active stages of understanding the full cultural impact of this pandemic. Trauma is not always well identified in real time, and trauma is well defined as damage to the mind and body that occurs as a result of a distressing event. Oftentimes when I'm assessing and treating a type of trauma that's occurred, often someone may not even start exhibiting symptoms until 3 to 6 months after the initial event occurred. And so we're still trying to figure out exactly how to make sure when we identify trauma, how we can get the most people possible to assess and to treat. But just understand when it comes to this pandemic that we're still in the midst of, that we do not fully understand the full scope of how this is going to impact our society, our culture. And so as a result of that, stress is going to be at all-time high. Some people may have noticed feeling really stressed out the first month or two when this initially came out. You may notice maybe you're having some stress later. But either way, trauma is trauma, and it's first, you know, it's important to identify that and to normalize that, because it is psychological stress that has occurred. It affects the mind and the body, and almost everyone has been affected by this pandemic, either going to the grocery store or trying to get gas. You know, we've all had fears of worried about getting sick or taking the illness back to our families. And so we've all had some type of trauma as a result. And we all know that racism is a very unique type of trauma as well. And so if you already had a lot of trauma prior to this happening, more than likely you will have some type of issues as a result. And so it's very important to identify that. So I just wanted to make it very clear that the mind and body are very connected. Brain states that produce mental illness also tend to activate inflammation in the body. So if you're under a great deal of stress and that's happening over a chronic duration of time, your body's going to have some changes as a result. In addition, if you have certain organ systems in your body not working properly, that also affects the mind as well. I tend to work in general hospitals where a psychiatrist has been consulted to assess a patient that may have chronic medical problems, or they may have mental health problems and now they have medical problems. And so that connection is very much there. And we have a very, our understanding of it is still a work in progress overall, but just know if you are in a negative space and you're thinking and you're not happy with, you know, different things going on in your mind and you're just having problems focusing, if it's causing some type of social dysfunction, as in it's hard to communicate with others, or you notice having some type of relationship problems, and you're noticing problems occurring in a professional level as well, you know, not only can that be detrimental to your well-being, but there's also body changes occurring too. Once we have a better understanding of inflammation and how to better treat that, I feel like we'll have a lot of great advances in science and technology. But for now, you know, it's very important to understand that if you're under a lot of stress for a long period of time, your body will be affected. And if you are not taking care of your body, your mind will be affected. So next, these are the list of symptoms that I have most commonly been treating as a result of the pandemic. So as I mentioned earlier, I work on a platform named Teladoc, and that I initially started working on that prior to the pandemic started, but it really blew up as far as the number of consultations I was getting from various states I'm licensed in. And these were a lot of the symptoms that I was treating with the patients. So depression is mostly described as, feeling sad on most days. There are a number of symptoms in conjunction with the period of time in which it occurs in order to have the diagnosis. So you can have trouble sleeping, things that you normally find enjoyable, you may have decreased interest in doing them. You may have very low energy where it's just really hard to get up in the mornings. You may have trouble focusing, your concentration could be affected where something that maybe would take you an hour to do and now it's taking you 3 or 4 hours to do, or maybe you're noticing you're just getting behind on things that you normally take care of in a faster process. You can have appetite changes where you may have weight loss or weight gain. And it can also present as irritability, particularly in younger adults, particularly like children and teenagers. They may not be able to say, I feel sad. They may just have more irritability. They may be getting in trouble more or getting more, being a bit more argumentative, things like that. But these are definitely common symptoms I'm seeing as a result of the COVID-19 pandemic. Anxiety and feeling overwhelmed is also common because people are just afraid of getting sick. Due to working at home, a lot of people are just having disruptions in the structure of their day, and then they're having some insomnia as well as a result. We're all using our technology more frequently now, just accessing our cell phones and computers. That's why we're staying up to date on information regarding this pandemic. But that can also lead to having issues with insomnia as well. And so once again, as a result of this new world that we're living in, it's very important for us to be mindful of how we are taking in information and what we're thinking about and how we're feeling, because ultimately long-term stress will compromise your immune system, and compromised immune system will leave you open to this infection. So just to quickly talk about individuals that are prone to stress during the pandemic, anyone with any type of underlying medical condition, if you're younger and you just don't really understand what's going on and you're still, understanding who you are, it can be difficult to deal with a national crisis as well. If you're taking care of family members at home, you can have increased stress of giving them COVID. Complicated grieving is occurring as well because a lot of people are not able to visit their sick loved one as a result of this pandemic. And if they end up passing away due to the social distancing procedures in place, that funeral arrangements are just different. And so there's a lot of complicated grieving going on as well. If you're in any type of job in which you're around a lot of people, of course, you're going to be worried about getting sick, even if you have all the proper gear. Any existing mental health conditions that are not treated. And I will say that a lot of the patients that I've been seeing that were receiving treatment prior to the pandemic, I'm not saying they're doing great, but they actually did pretty well. A lot of them were pretty resilient in doing much better because they understood their responses to emotional distress, and they already had a toolkit in place when those happened. Any type of substance use disorder, individual with disabilities, and if you're living in any type of like group home or dormitory or apartment buildings, you're also going to be prone to be stressed because you're also just worried about getting sick. So I just wanted to briefly just discuss the difference between seeing a psychiatrist and psychologist. As a psychiatrist, we go through 4 years of medical school. We do time doing internal medicine and neurology, and then we do various different types of psychiatric work in inpatient settings, outpatient settings, in order for us to provide mental health care using medication management. Psychologists, they have LPCs, MSWs, PsyDs, PhDs. They spend a large amount of time focusing on different methodologies behind emotional distress, and different types of therapists will have different types of strategies. Due to media, there's always a confusion between, should I see a psychiatrist or a psychologist? If you want to feel more comfortable seeing a therapist first, that's fine. If they have knowledge, understanding when someone may need medication, that their symptoms are likely coming forward because of some type of neurochemical imbalance. And so a therapist will let you know if they feel like it's in your best interest to see a psychiatrist. And if you see a psychiatrist, more than likely we're going to recommend that you see a therapist, because we know that you have the best improvement in outcomes when you're just engaging all your options. So I was trying to find, some type of takeaway image that would, embody the type of work that needs to be done in the midst of this pandemic. And this was like the best image that I found. This could be, anyone can take a screenshot of this and just pass it to friends, or family, and even the children. I think it's very easy to understand. In the midst of a crisis, these are all good categories to keep in mind while we're dealing with this. And once a week, if you actually went through every category and just graded yourself, if you wanted to score it 0 to 10, 10 being you're doing a great job, 0, not a good job at all. And if you did this for every category, at least once a week, you're just more likely to be in a better mental health space compared to not doing it at all. And so you can say, well, I'm doing great exercising, but I'm not sleeping well. Diet can use some work as well. I'm not doing deep breathing. I have some habits I need to control. If you really go through this list and just score it, and you score it weekly, and it really just put it part of the to-do list, you'll fare out much better, and you'll at least understand yourself better, and you'll know what options are available to treat whatever issue is going on. All right, so I wanted to just list the type of symptoms that usually medication can be very useful. If you're having ruminating thoughts, as in you're thinking about the same thing over and over again, you look up, it's been 3-4 hours, you haven't gotten anything done. Usually, there are tons of different types of therapeutic techniques that can help, but medication also works pretty well. If you're thinking about self-harm, you're having some type of perception of reality issues, whereas you're having hallucinations, both visual, where you're seeing things, or maybe you're hearing things. If you're having panic attacks in which you have shortness of breath, your chest feels very tight, you feel like you're maybe having a heart attack, when you went to the ER and they realize, nothing's going on here, it's just anxiety. If you're having those symptoms, usually medication is actually a good option to explore. And when you go to see a psychiatrist, we're starting medication trials. The goal is to start at the lowest dose possible. The goal is to have someone try the medication, see if it helps them. We do not want someone coming into the office drooling, sleeping all day. That's not really what we want out of our patients. We have a great sense of pride in what we do, and we really like helping people feel better. And feeling better is not getting a bunch of side effects. Sometimes, depending on the type of illness going on, we have to, weigh out the risk and benefits. But overall, the goal is just to help you out and for you to have something in your toolbox to help you. But when you're having certain types of symptoms that are physiological in nature, it's very hard to reset that clock without some type of further intervention. And if you're having paranoia, insomnia, those are also things that can be difficult to really shake by yourself. So some of the misconceptions and concerns with, talking to a psychiatrist and trying to engage the option of being on a medication. I often hear patients being afraid of a permanent change to their brain chemistry. That is oftentimes not true. Actually, the medication doesn't last that long in your system, and it does require some people to take them every day because it wears off pretty quickly. And so we're not doing anything to cause brain chemistry. And when you're working with a doctor, working with a psychiatrist to prescribe medication for you, we are aware of the different side effects that we have to be careful about, that patients can have complications as a result of. And we take it very seriously. Most of our training is actually geared towards making sure something bad doesn't happen to a patient. And so we care about that quite a bit. Some people, there are certain medications that can cause some type of slowing where you feel like you're not as sharp, but usually that's for more severe conditions. And normally when you're working with your doctor, we can really work around this. There's a lot of options available. And oftentimes we're really just trying to help someone understand what's available. And with the stigma being what it is, people oftentimes are not really privy to understanding what options that they have. And so our goal is just to really provide that as a consultation so that you can move forward with knowledge and power to just improve what's going on. But the brain ages like every other organ. It's important to know if you are having certain types of symptoms that you have been trying to do on your own and it's not working well. It's just best to seek some type of help and to understand what options you have, okay? And oftentimes you hear people say, I'm too busy to have a therapist, I'm too busy to do this and that. And, we understand that. Oftentimes in training, we know the effects of socioeconomic issues and how that impacts mental health, how that impacts your body and your health outcomes. And so we do know that there are a lot of challenges in being able to access this type of services, but you're more likely to be sharper if you are able to do that. And part of the goal to eradicate the stigma is really to just normalize it, to understand that, it is a competitive advantage to be at your best mental health state. You know, you're less likely to make mistakes. You're more likely to move on once you do make a mistake. And so no matter how you cut it, the more you actually normalize the fact that, okay, my brain needs to be healthy, like any other organ in our body, the better your outcomes will be. I pulled a few images that I found online and just kind of ways to just embark on understanding that your brain is capable of affecting your body, that, you know, exercises and visualization, as well as in deep breathing, and finding time to find your peace and trying to actively work on that will overall help you to be in better physical health and mental health. And so whether you're visualizing positive situations, you're, you know, changing routines, you're doing deep breathing, you're working on meditation, it has to be some type of exercise that you're doing in order to really optimize where you want to be in your life and optimize your physical health as well. And I also pulled this online. A lot of people are struggling with structure changes in their day due to working at home and their kids are there or their partner's there. And so, you know, it can be very difficult to try to mimic the schedule that you may have at work from working at home. I found this pretty useful tool. You know, it's just different ways you can just block out times in your day in order to, you know, just add more structure. So you want to just take a screenshot of this, feel free to. I found a lot of good things on Pinterest as well. There's just a lot of access online, you know, but as much as we're dealing with a lot of false information that can sometimes be put on the internet, you can also find a lot of good data as well. And lastly, you know, whatever, you know, I made a point to just pick different images that really embody the same message. That ultimately, if you're just going through this checklist and really just having an honest conversation with yourself about how you are doing and at each category, you're just more likely to be in a better place of health. And once something is brought to your attention, it's very hard to ignore it. And so, you know, you'll notice if you're really thinking about your sleep, you'll just start to do things differently in order to improve your sleep. You know, once we get our mind, you know, moving towards something, the subconscious starts to work on it too. So, you know, we have a lot of activity that we do, a lot of things that we have going on in our bodies that we're not necessarily thinking about, but it's happening automatically. But once you start to put these things in the forefront of your mind, you'll just start working on it, you know. So once again, it's just a really good time to have a quick way to make this assessment, to just grade yourself. You do this once a week, you'll be better off. And lastly, there are a lot of resources available if you are in acute need for help. The CDC has a lot of good articles on how to manage stress, and there are a ton of different hotlines available if you feel that you are unable to do these things on your own. You know, take the time to work with people who have dedicated, you know, a decade of their time to help you out. You know, there's not a lot of situations we haven't heard of before. Of course, you know, the Black experience is very unique, and, you know, you may find that a lot of mental health professionals may not understand every nuance of that, but overall, they'll still be worth working with compared to doing this on your own. So just never forget that there are resources available. And I believe that's the end. So thanks for having me, and hope that was helpful.
Thank you so much, Dr. Oden, for your clinical expertise on mental health. That was a very impactful presentation. Our next presenter is Dr. Margaret Lynn Yonekura, a board-certified OBGYN with a subspecialty in maternal fetal medicine. She is the founder and executive director for Options for Recovery, created in 1990 during the crack cocaine epidemic in Los Angeles County. She has become the director of community health at Dignity Health California Hospital Medical Center, a safety net hospital in downtown Los Angeles. Lynn is also the executive director of Best Babies Network and the founding member of Maternal Mental Health Now. Dr. Yonekura will be discussing substance abuse disorders. Please welcome Dr. Lynn Yonekura.
Good morning, everybody, and thank you so much for inviting me to this, join you in this conference. Next. Addiction is a disease of isolation, and there's no doubt that when the order came for us to shelter in place, that we would see a rise in addiction. Unfortunately, liquor stores and marijuana dispensaries were also seen as essential services. And so there's ready access to at least 2 major drugs. Back please. As one gentleman said, it's when you feel alone, stigmatized, and hopeless that you are most vulnerable and at risk. So much of addiction has nothing to do with the substance itself. It has to do with pain or distress or needs that aren't being met. So, what has the impact of this pandemic been on our mental health? Well, I think our previous speaker summarized that quite nicely. But we all know that it's resulted in massive doses of fear, uncertainty, anxiety, and depression. And most importantly, it's cut us off from human connections that typically help ease these burdens. As one mother said of her son's accidental fatal overdose, after 8 years of sobriety, the virus took away one of the strongest forces in his life, the presence of people who loved him. 12-step meetings, which many people in recovery depend on to stay sober, have been shuttered. Many have gone virtual, but not all people have access to these virtual meetings. Likewise, many treatment centers have shut down. Some have gone out of business. Others have just closed until future times. So why are we seeing a rise in substance use? Well, fear and uncertainty are major stressors that can increase our risk for developing mental health issues, substance use disorders, and suicidal ideation. Common risk factors include a pre-existing mental health disorder or substance use disorder, a history of trauma or toxic stress, social isolation, a higher level of disruption to your life, older age, women in households with children and adolescents, loss of income or job, and our latest unemployment rate in LA County is almost 20%, but we know in communities of color, it's much higher than that. Low household income and poor physical health. And people are grieving multiple losses. Could be losses of loved ones, losses of certain milestones such as graduations, weddings, etc., loss of their job. So grief is a powerful force. But fortunately, the Substance Use Prevention and Control Network in LA County is also an essential service, just like the hospitals. And it stayed open. There's 24-hour access, 24/7, via the toll-free Substance Abuse Services Helpline, otherwise known as SASH. You can jot down this number. You can call it anytime you need it. Alternatively, you can visit the online directory to find providers near you. Know that the vast majority of services are presently being provided virtually, so you don't even have to leave your home to get treatment. And an appointment will be made for you within 10 days of your reaching out, usually sooner. Who's eligible? Youth and adults can access no-cost substance use treatment service at any network provider if you meet the following criteria. You're Medi-Cal eligible, or you have MyHealth LA, or you're participating in another county-funded program, and you're a Los Angeles County resident. The services that are available span the entire spectrum, from brief outpatient services for at-risk youth and young adults, outpatient treatment, intensive outpatient treatment, short-term residential treatment, withdrawal management, medication-assisted treatment for those who are addicted to opioids or alcohol, recovery support services, and even recovery bridge housing for those that are homeless. We all know that women are unique, and Options for Recovery was designed as a program for women by women and treated by women. It's located on the grounds of Harbor UCLA Medical Center in Torrance. Originally, it was designed as an intensive outpatient treatment program for pregnant and parenting women with infants and young children. So we have childcare on site in addition to providing treatment services. Today, we provide outpatient and intensive outpatient services, as well as recovery support services for women of any age. And we also accept women who are on medication-assisted treatment. Call us, and we'd be glad to speak to you and try to help you. Thank you so much.
Thank you so much, Dr. Yonekura, for your very insightful presentation on substance use disorder. Our next presenter is Sean Inoue, account manager with the American Red Cross. Sean found his passion for nonprofit work 10 years ago while volunteering, providing vital services while volunteering at the Laurel Foundation, a camp focused on services to families affected by HIV and AIDS. After a brief run consulting for various nonprofits on donor recruitment and fundraising, Sean landed at the American Red Cross in the Biomedical Services and has managed several blood collection territories throughout the greater Los Angeles area, focusing on strategic partnerships, donor recruitment, blood donor diversification, and community preparedness. With that, let's welcome Sean.
Good morning, everybody. Thanks for having me today. So I wanted to talk about blood donations during this pandemic, talk a little bit about how COVID has impacted our blood supply, and specifically address the importance of the African American community in serving diverse patient populations. Now, this is a ton of information, so I'm going to kind of plow through it and then keep an eye on the chat towards the end of the symposium. But this is really the effects of COVID on our blood supply. So most of us know that there is a blood supply, it's managed somehow, and then if you go to the hospital and heaven forbid you ever need it, it's there. So typically this is done through people like me. We manage the long-term blood supply by determining how much blood we historically use with our hospital partners. We work with our community partners to collect a specific amount of blood to meet those needs. And normally there's plenty of donors to meet that, right? They're healthy, they're able to come into work. During disasters, heaven forbid they take place, we can shift our blood supply around from, let's say, Los Angeles to Alabama if there's a hurricane or something like that. And generally, supply is pretty predictable. It's pretty stable, right? But in this COVID area, it's really unpredictable, right? So we're seeing a steep swing in the need for blood, whether or not elective surgeries are still taking place. Of course, things that are so critical like cancer treatments, sickle cell treatments, you name it, there's still blood products that are being used on an everyday basis. And there's a fewer healthy donor population, right? People who are not feeling well or just being on the safer side and staying at home during this pandemic. Obviously, that makes us a little bit less agile when we're talking about balancing our blood supply to those localized disasters. Now, thankfully, we haven't had too many. We're talking about a big hurricane coming into the Hawaiian Islands pretty soon. But hopefully that downgrades and we're not seeing too big of an impact on their blood supply as well. So this unpredictability, kind of this heightened need, it's really kind of strained our flexibility in terms of being able to plan a really stable blood supply. Now, we're trying to be as flexible as possible and really working with our community partners. So, of course, we're communicating with all of our federal branches, all of our national organizations like the CDC and the FDA. We're really looking every day at the opportunities to increase our protocols to make sure people are feeling safe with our blood drives, that we're staying informed with the evolution of the information coming out about COVID, about how to keep people safe, not only at the blood drives, but in our hospitals where they're getting that treatment. And then we're really making sure that our inventory levels are stable, our supplies, our staffing, the way that we're communicating the expectations and how we need to adapt. And gratefully, we've had an outpouring of support from our community, but that's seeming to wane here and there. So the blood supply has been fairly stable. We saw a pretty significant dip in the early on part of it, but now we're seeing more complex challenges with our blood. So one of the biggest things I think is that impacting that is fear, right? People are scared, rightfully so. We want to really define being cautious and being socially distant without being socially engaged. And so the Red Cross has worked really closely with the FDA and, like I said, our national health organizations to make sure that we've put steps in place to not only keep our donors safe, but of course our staff, our volunteers, the partners that are hosting these blood drives, and making sure, of course, at the end of the day, the patients that are receiving this blood, they're going to be safe. So we already have a very high standard of safety and infection control at our blood drives, right? We're collecting blood. We want to be as safe as possible. But to really take it to the next level, we've done things like implement temperature checks before people even enter the building. So this includes our staff, this includes volunteers that are there that will be actually taking temperatures for our donors, people that are helping with registration, really anybody who's coming into a blood drive, even the people who are opening the doors for us. This also includes us increasing our disinfecting frequency, right? So we already do things like change our gloves, wipe down surfaces in between donor contacts, staff contacts. We've taken it to another level where every piece of equipment, every surface, every bed, every chair is being wiped down between each donation. And that includes, of course, changing gloves, right? All our staff, volunteers, and donors are all asked to wear masks as well. They're unable to provide one, we'll provide one for them. And then keeping that social distance that we've been hearing about so frequently is really important. You see transmission rates drop dramatically when people are not only just wearing a mask, but they're also keeping that social distance. And then, of course, to make sure that we're reinforcing all of this, we have hand sanitizer at every station of the blood donation process to make sure that people have the opportunity to disinfect when they can. So social distancing, right? It plays a little bit more of a complex role in the way we collect blood. There's generally two ways people think about donating blood. There's at our blood drives at community centers, churches, schools, maybe at your place of work. Generally, those are inside of a large room, generally about 1,000 to 1,500 square feet, hopefully larger where we can. But we also have blood mobiles. And so blood mobiles have been a little bit challenging, as you can kind of imagine. These kind of large buses that have been retrofitted to collect blood aren't really, you can't really socially distance effectively on them. We've installed specific equipment on there now to really allow maybe 2 to 3 donors at the most on there at one time. Those plexiglass shields you see at the grocery stores, we've now installed those on some of our blood mobiles. So we're just starting to pilot those back out into the field right now. Really, we need community blood drives. I can't drive that home any harder. This is where we can like I said, host at your church in a fellowship hall or in a parish hall or at a temple or at a school gym. YMCA's have been really supportive during this time, and that's really where we've adapted what we call our site suitability standards, where we're asking for more space, where we can set up those 3 separate areas: the screening areas for donors before they come in, of course, the screening areas for those donors before they give blood, and then the post-collection area where it's everybody's favorite. We fill you up with juice and cookies, socially distant high fives, thank you for giving blood. And then of course our waiting area. That's a little bit more flexible because we can have donors wait outside or in their cars and we'll text them when we're ready to see them. But again, the entire theme of what we're doing in our blood drives is safety. And that's really what I want to drive home. We understand there's a lot of concern and it's rightfully founded, but we want to make sure, like I said, we're finding that balance between social distancing and concern and really disengaging from our kind of social responsibilities. And this is an incredible way to still make an impact during this time. And that kind of brings me to the next portion. Our community here is primarily African American, and y'all play a huge role in making sure we have a diverse blood bank for the diverse populations that we serve, specifically with sickle cell anemia, and I'll get into that in a second. So we talk about diversity in our blood supply, and I specifically mentioned sickle cell anemia. Generally, the Red Cross, we collect about 14,000 units a day. So this is just ballpark about 500 blood drives that collect anywhere between 30 units of blood, and I think our largest blood drive is maybe 200 units of blood. There's one that collects around 400, but these are kind of few and far between on that scale. So when we talk about its critical nature and the reason why having a diverse supply is so important, you know about ABO blood types, or most of you have probably heard about it, right? Your A type, your O type, your AB, then you hear about those negatives and positives. Those antigens, those RH factors is a whole nother system. And there's about 600 different subtypes, more discovered frequently. But those are really important for a specific match on people who are getting frequent transfusions, people who require transfusions as their medicine, people who receive platelet transfusions maybe twice a week. All those types of things are really important because we want to reduce the potential complication risk for those patients who are receiving those blood products. And the best way to do that, or one of the best ways to do that, is to make sure we're getting an exact match, not just with those ABO type systems that you typically know about, but also with those RH factor systems as well. So blood types is really complex, and I've been doing this for a significant amount of time, and there's still more to learn. But like I mentioned, there are hundreds of known antigens, right? And some are really unique to different demographics, racial and ethnic groups. Specifically, when we talk about the CEK antigens, that's where the Black and African American community have a really high presence of it. Specifically, O positive type donors are really common, or the most common in our Black and African American communities. And O positive, if you don't already know, it's not the universal donor, that's O negative. But O positive, you can give about 70% of the population. So we're talking A positive, O positive, AB positive, and B positive. It's a pretty big group of the community that you can give blood to. Unfortunately, O positive and O negative, you can only receive blood from those types respectively. So if you're O positive, you can get from O negative, O positive. If you're O negative, you can only get from O negative. So if you are O negative and you know you are, that much more important that you give blood, heaven forbid, or knock on wood that you ever actually need it. But the reason why that blood is available is because other O negative donors have literally rolled up their sleeves, given part of themselves away. I'm a little biased, but it's the spirit of philanthropy, right? You're giving part of your body away to make sure somebody has the medicine they need on possibly one of the toughest days in their life. So the stats below are just kind of a reemphasis of what I was talking to you about, the blood types, the percentages based off ethnic groups and racial groups. And specifically, when we talk about African American communities, you see 73% the CEK negative, that's those antigens I was telling you about. And those are specifically really important to sickle cell patients. So sickle cell disease, if some of you don't already know what it is, it's usually a genetic disease, or it is a genetic disease that's inherited, where your red blood cells aren't circular like normal, right? So our red blood cells carry our oxygen, and the size of that, the surface area of your red blood cell is really important with our oxygen carrying capacity, along with iron, things like that. So sickle cell means your red blood cell is shaped like a sickle or a C or a crescent moon, which severely limits its capacity to carry nutrients and oxygen. So, it's the most common inherited blood disease in the United States. We're talking about 100,000 Americans that have this, and about 1 in every 365 Black or African American births specifically are impacted by sickle cell anemia. Now, this is significantly larger than any of the next most impacted community is the Hispanic American community. So we're talking 1 in every 16,000. It disproportionately impacts our Black and African American communities. So this is really where I was talking about making it really specific with having a diverse blood supply, because sickle cell patients, one of their treatments is going to be getting what's called packed red blood cells. So speaking really quickly, thanks for hanging in there with me. When people are getting blood products, we call them, there are 3 main types that they're going to be getting, or 3 parts of the blood that we'll use: red blood cells, platelets, and plasma. And then those 3 things together we call a whole blood donation. So when people are getting frequent transfusions, like I mentioned, having those really unique blood type antigens are really important. These are sickle cell patients that are receiving what's called packed red blood cells, and it's kind of like a concentrated dose of red blood cells. People give those at blood drives. You think about whole blood donations, that's what you think about with normal donations. But there's something called power red, or an apheresis donation, where we just collect red blood cells. If you're O positive or O negative, we ask you to do that. And this is what our patients are receiving. This is what sickle cell patients are receiving. And specifically for our African American communities, those 3 antigens that we mentioned, the AEK antigens, are really prevalent. So when we're talking about treating those patients and finding that exact match, that's really where your role makes a huge difference. So we're not doing a great job. We need to communicate this better, and that's why I'm really grateful for the opportunity to speak to you guys today. We're talking about really only engaging about 0.5% of the population when it comes to getting blood in these communities. Now, Los Angeles, we're somewhat stable. We're doing okay. But across the nation, we're seeing, because we're a national blood bank, big deficits in some of our big cities that are impacted by COVID right now. Generally, and I'll show you on the next slide in a second, but this is, I think, a testament to how we're not doing such a great job on, engaging with our African American and Black community on collecting blood. But if you go to the next slide, there's this, chart. I'll wait for it to come up, sorry. Perfect. So we talk about donations just generally as about 4,000 a week from our African American or Black community. It's just an average, right? But you notice when at the peak of our rightfully so, during our pandemic quarantine, you see that steeply drop off, right? We're down in the almost sub 2000s starting the week of the 16th in March. So, there's a lot of different reasons why this is happening. Dr. Fauci talks about at-risk communities or, being disproportionately impacted by this, whether it be, because, or in blood donation specifically, because, we're seeing increased concerns for safety over COVID, which is why I really wanted to address that in the beginning. Closure of donation sites. So our normal places that are hosting blood drives aren't really hosting them anymore, whether there's nobody there to open them or there's concerns about COVID. Even with all the steps that we're taking, some people aren't comfortable, which is totally fair. I hope that I inspire confidence a little bit here on the procedures that the Red Cross has taken to keep everybody safe. And of course, there's things like childcare constraints, right? I'm not going to leave my 3-year-old at home, by herself or by himself without somebody to watch him or her if I'm going to give blood, right? So there's significant things that are impacting really our African American community's ability to come and give blood, right? And then this is not just unique to the African American or Black community. This is across the nation too. So here's my call to action, right? We know why it's important to have a diverse blood supply. You know about the reasons or the things that the Red Cross is doing to keep donors safe at our blood drives. And this is not just the Red Cross, right? A lot of blood banks have implemented these procedures as well. But there's a lot of ways to impact, right? Not everybody's comfortable giving blood. And I encourage you, if you're not, that's okay. It's scary. Blood is weird. Needles can be really, really scary for a lot of people. It's a really brave thing, right? And bravery doesn't exist without fear in some small way, right? So when you're giving blood, that's what you're doing. You're addressing that fear. I mean, again, I'm a little biased here. You're literally rolling up your sleeves and giving part of yourselves away. You're giving part of your body away to a stranger because you know they're going to be there for you someday. That blood's going to be on the shelf, heaven forbid, or knock on wood, that you're ever going to really need it, right? And if you can't give blood, encourage others to do it. Have a conversation about it, right? If you're not comfortable, if there's something you're afraid of, or there's a myth that you've heard about giving blood, ask about it, right? Put it in the chat, or ask a Red Cross person, or call it in, right? There's a lot of things have changed in the last decade, just in the last year, about eligibility. Tattoos are okay, piercings are okay, smoking's fine, drinking's fine. Obviously in moderation, we want to make sure people are safe when they're giving blood, so we'll do a mini physical for you. But there's a lot of things that now people are eligible, even having done, that was a weird way to say it, but if you've gotten a tattoo in even the last 3 months, you can still give blood, things like that. But if you're not comfortable giving blood or you can't do it, volunteer, right? We need people to take those temperatures, drive the blood from our hospitals or from our labs to our hospitals. And that need is really growing, right? At the bottom of this page, there are 3 links. You can actually volunteer at redcrossblood.org/volunteer. And this is that temperature screeners, the blood donor ambassadors. You can host a drive. One of our most successful blood drives is at churches. We're hosting huge football or blood drives now at the LAFC, the football club. Or you can donate yourself, right? Whether it be in kind or donate monetarily to some of the food banks that we're working with right now. Makes a huge difference, and there's always a way to help out, even if you can't give blood. And it's thank you. I mean, this is an important page to me. We know that giving blood helps people. We know that people need it. We know that there's sickle cell patients, that there's cancer patients. We don't really get to meet them all the time. We know that when we give blood, it goes into this ether, but take the time. Watch one of our stories from one of our recipients, and hopefully none of you have known somebody who's needed blood, but if you do, you know how much of an impact it makes. So if you haven't before, if you haven't heard somebody's story, check out a story. Meet the people who have received the blood products and how big of an impact not only it makes on their physical health, but their emotional health too, right? Making sure somebody's been there to make sure that blood is there for them in their time of need. Thank you guys again for having me on today. I'm honored to be part of this.
Thank you so much, Sean. That was a really impactful presentation on safety aspects and importance of donating blood, a need that is amplified in the African American community. Our next panelist is Tim Gipson. He's a retired Los Angeles police officer, financial crimes investigator with over 32 years of law enforcement experience. He is well versed in tactical gang operations and suppression of high-profile theft and organized crime activity. Today, Tim will be speaking to us about avoiding scams during the COVID-19 era. So with that, please welcome Tim Gipson.
Thank you, and thanks for having me. I really enjoyed the first presenters. I think they have a wealth of information, and I hope I can continue that trend for you. Today, I'll be talking to you about several fraud scams and social media scams, in particular, social security scams, stage auto collisions, coronavirus scams, and work at home scams. The social media scams, I think you may have already been victimized by this. If not, you probably most certainly will be. One that's out there now is where they're compromising your email account and they're sending messages. They'll send vulgar messages out to all of the people in your email list. And the only way that you'll find out about that is somebody will call you or contact you and let you know. That's your clue to maybe send out a message to everybody in your address list and let them know that you did not send this message out. Twitter, as a matter of fact, a week ago or 2 weeks ago, was compromising accounts of very prominent individuals. Elon Musk, President Barack Obama, and Jeff Bezos. They had their accounts compromised. And what they were doing here is they were soliciting donations on behalf of coronavirus issues. And they were requesting that those donations be sent via Bitcoin or through Western Union. And the reason that they're doing this is because they want to make it a non-traceable activity. And they were able to compromise or receive approximately $188,000 before this was actually shut down. Now, another thing that you probably most likely been a part of is the Social Security scams. And these scams are real simple. You're going to get a phone call or an email, and they're going to ask you to provide information, which you should never do. They, in particular, want you to give your Social Security number, because with that, they can use it. They will use that to compromise your financial information. They will sell your Social Security number, of course, on the black web. So even if they don't use it, they will sell the information. And what you should look out for here is phone calls. Most compromises come through in phone calls. And the area codes will be spoofed to mimic your own phone number. So you will think that this is a caller maybe calling from your area, and you'll answer the phone, and it'll tell you that your Social Security number has been compromised. And for the elderly, they'll tell them that their benefits have been reduced or will be reduced unless they take action. And of course, that action is to send money in order to take care of this problem. They'll want them to send up to thousands of dollars to various sources or email addresses, or even mail in gift cards to take care of this problem, which you of course should never do. Now, another thing that, I don't know if you've been a victim of this, but it is happening, and you will not realize that it's really happening to you until it happens or until it's too late. And that's stage auto collisions. It's the coronavirus time. There's a lot of people out of work. There's a lot of people looking to make money. So there's a lot of this going on as well. And they have what they call a swoop and SWAT, where a car will get in front of you and they'll stop and have you rear end that car. And what you want to look out for is, like I say, it's unsuspecting, so you may be totally unaware that this is happening to you. But what you'll find is that there'll be more than one person in the car. Usually there'll be up to 4 people in the car in front of you, and then there'll be a car to the right of you. And what'll happen is the car in front of you will stop urgently, and you'll slam into the back of that car, or you'll try to escape to the right. So you'll either hit the car behind you, or you'll pull out and hit the car to your right, which also will have up to 3 to 4 occupants in that vehicle as well. And the whole thing is that all of the occupants in these vehicles will later claim soft tissue injuries, and they'll go after your insurance company. But you, like I said, you want to be aware of this. You want to keep an ample distance between you and the car ahead of you, and you want to make sure that you have an out, that you can get around the car, which means staying aware of your surroundings, and possibly keeping your cell phone in the cup holder or in your glove box would probably be even better. Okay, the next one I'll talk to you about is work at home scams. There's a lot of this going on as well. You're at home, you would love to work from home. So these are usually solicitations that come also by way of emails. You'll see solicitations in the newspaper, and they'll ask you to send in your personal information sort of as a job application process. And they'll gain your information that way, and then lo and behold, they'll tell you that you're going to be working in the accounting office, and then they'll send you checks, and they'll ask you to cash or negotiate checks, which will have your name on it, but the account of another company. And as soon as you cash that check, of course, 2 weeks later or so, your bank is going to contact you and let you know that there's a problem with that check. So what you want to do in that situation, of course, is you don't want to, well, let me back up a little bit. What you can do in that situation, if you think that it's a legitimate company, ask them to give you an in-person meeting. And if that doesn't happen, that's your first clue that this is not a good operation and something that you should be involved in. With that, I'll say thank you for your time, and I'll maybe have some questions in the question and answer in the chat portion of this, and thank you.
Thank you so much, Tim, for that presentation. I hope our audience will heed the great advice he has given us about avoiding scams during this new era. Now we'll move into the social-political portion of our program. We'll begin with Councilwoman Tana McCoy, representing the 3rd District in the great city of Compton. Councilwoman McCoy is a native of Compton, and her love for people in her community kept her a loyal, trusted public servant and employee of the city of Compton for over 40 years. She has served in various administrative positions in the mayor and city council's office and the Compton Water Department. During her tenure with the city as council liaison officer, she became a the staff person assigned to the Compton Commission on the Status of Women, a position she's held for over 30 years. Please welcome Councilwoman Tana McCoy.
Good morning, and thank you for inviting me to participate. My name again is Tana McCoy, and I am the councilwoman from the great 3rd District in the city of Compton. I'm going to talk to you a few minutes about your rights to vote and the importance of voter registration. And so, voter suppression has been around for hundreds of years. If the African Americans were given the right to vote after the Civil War in 1865, then why were they still fighting for the right to vote in 1965? The Voting Rights Act was passed to ensure that state and local government would not pass laws or policies that deny American citizens the equal right to vote based on race. As the leading democracy of the world, the United States should work to keep voting free, fair, and accessible, but this has not been the case. Since 2008, voting rights have been under attack nationwide. Laws have been passed to make it harder for Americans, particularly Black people, elderly people, and people with disabilities to vote. Laws such as ID requirements and the purging of voter rolls are all forms of voter suppression. Intimidation can cause low voter turnout. The last city election had a very low voter turnout. As city leaders, we must stress the importance of voting. People often feel as though their vote doesn't matter, but we must continue to communicate the message that our vote matters, and we must vote like our lives matter. How do we stop voter suppression? Education is the key to voter suppression. Last election, we were provided with a new voting method with minimal training. This election, every registered voter will receive a mail-in ballot. This will alleviate confusion at the polls and the long lines. More than ever, we need to educate our citizens on the importance of their vote. I have previously partnered with the Delta Sigma Theta sorority Compton chapter to host voter registration drives and voter education campaigns, and I will partner with them again, as well as local elected officials, fraternities, churches, block club leaders, just so that we can make sure that our point is out there. We must vote for our lives. Together, we can make a difference by informing the residents, hosting voter registration campaigns, and educate the community on their voting rights. Knowledge is power, and I plan to post public service announcements to carry the message that we must have our voices heard at the polls. If you're not sure if you're registered, go to www.lacounty.gov and you can check your election status. And remember to vote. Remember, your vote matters. And please vote November 3rd, 2020. Again, thank you for inviting me to participate in this awesome event, and thank you.
Thank you so much, Councilwoman Tana McCoy. We appreciate the work you've done in the community and will continue to do for the great city of Compton. Next is our California State Assembly member, Mike A. Gipson, who represents the 64th District, which includes the communities of Compton, Carson, Gardena, Harbor Gateway, Linwood, North Long Beach, Rancho Dominguez, South Los Angeles, Torrance, Watts, Willowbrook, and Wilmington. A native of Watts, Assemblymember Gipson currently serves as the Assembly Democratic Caucus Chair, responsible for driving the legislative decision-making process for the Majority Caucus, addressing statewide issues and holding weekly meetings to discuss and set caucus priorities. With that, please welcome Assemblymember Mike Gipson.
Thank you very much, Brother Coleman. I really appreciate the opportunity. I want to congratulate all of you for the 14th annual Dr. Charles R. Drew Health Symposium. And I want to thank the Tata chapter for continue to be a leader in this space. And thank you so very much for your leadership. I want to also thank Brother Charles Ezell for the invitation, for extending his invitation to me to come on and be part of this conversation. I also want to acknowledge all the other panels, the other panelists rather, including the great Councilwoman Tana McCoy from the great 3rd District of the city of Compton. I'm very grateful for her leadership. And to Brother Tim Gipson, I don't know if we're related or not, brother, but we have the same last name, so I have to believe that we're cousins. And so thank you very much for your presentation. Also, Sean. I've been tasked with the responsibility to talk about the voting rights, but let me simply say this. Councilwoman did a superb job by talking about voting rights. It is important. Understand this, that 55 years ago, which will get us to 1965, before the Voting Rights Act was even put into law, giving Black people the right to vote. And we have to reauthorize this once every 25 years, but it's only for Black people. Please understand what I just said. 55 years ago, we didn't have the right to vote until the Voting Rights Act of 1965 was actually implemented and signed into law. But what we had to go through is that people had to go to the registrar's office and also look at a jar of jelly beans and guess how many jelly beans, to whether or not you have IQ or not, to be able to vote. That's the discrimination that we had to go through as a people in the United States of America. And we should not have to go through that. But also the injustice is that we have to have permission by Congress. Understand what I just said. We have to have the permission from Congress in order for us to reauthorize the Voting Rights Act of 1965 that gives us the right to vote. But no one else have to. So I want you to chew on that for a moment, because I think that's very, very important, that you have to understand what's going on. We're about change, and certainly, if you look at all the demonstrations, and if you look at Brother George Floyd, and if you're outraged like I was outraged, if you protested, if you signed up for a petition, if your voice mattered, Dr. Martin Luther King said this, Brother Coleman, that silence is a form of betrayal. Silence is. Everybody that marched, everybody that protested, they said that I refuse to be silent about the things that matter. George Floyd's life mattered. And how we exercise changing that kind of discrimination, that kind of murdering activity that took place, is that we have to make sure that we register to vote. Why are you saying that? Well, I'm glad you asked. Because we can now effect positive change in our elections. If you have an elected sheriff like LA County does, well, he's elected. If you don't like what he does, then you vote his butt out. That's what the power of the vote means to all of us. And so if you don't go out and vote, damn it, you don't have nothing to say. You found guilty of being silent about the things that matter. So don't complain about what you see on TV or this is unfair. If you don't go out and vote and exercise that vote, and I know my brothers from Tata chapter, they're talking about it, they're preaching about it, they're effecting change in their community and making sure they are not found guilty of the things that matter. And if you are fed up with what's going on in the White House, I would simply say you need to vote. You need to make sure that you exercise your right to vote this come November 3rd. And I know everybody said that every election is important. Well, that's a true statement, because every election is important. We must go out and vote, because if you are okay with what's going on right now in our world with white supremacies, and it's being validated from the highest office in the land, who is confused, who is an idiot himself, if you're okay with that, then you shut up, you vote for him. But if you're tired of being tired, then you're going to go out and exercise your right to vote, this coming November. And I want to challenge everybody under the sound of my voice. If you register to vote, then that's great. You need to find somebody in your family who is eligible to vote and get a voter registration card in front of them, fill it out, and make sure it's deposited into the mailbox so that they can get their ballot. We are now experiencing, because of COVID-19, some unusual times that I have never seen in my entire life, where we have COVID-19 that is controlling the narrative. COVID-19 is controlling the agenda. And what we have to do is make sure, because all of our ballots in November will be a mail-in ballot. Most of us will not have an opportunity to go to the polls and vote, because Black people enjoy that for the simple fact because it was ingrained in us during the civil rights movement that we went to the polls, exercise our right to vote, so we can have we can have a real seat at the table when it comes down to dynamics and politics in our community. So because we will have a mail-in ballot, it's easy for some of you. You need to vote in November 3rd, not only for the president, not only for member of Congress, but you need to vote for state senator, state assembly member. I'm on the ballot. You need to vote for school board. You need to vote for water board, city council, measures. You need to understand what's on the ballot and then vote intelligently. So simply this, we need to make sure that people of color who are fed up and tired of being tired go out to the polls and vote. Simple as that. Simple as that. Don't be found guilty. I was also asked to talk about the census. If we don't, one, be counted, just like we're asking people to be counted with your vote on November 3rd, we're also in the era of our census that is done once every 10 years. If you are a newborn, if you just had a baby yesterday, then you count that baby. If your grandmother or mother's in the 90s, that person has to be counted. Everybody in between must be counted when it comes down to this census, because if not, then we stand to lose about $400 billion that California needs. My cities, Compton, Carson, Wilmington, North Long Beach, Linwood, Gardena, we need that money, because if we don't get that money, that allocation, then we're now diminishing the services that people who are in underserved communities so desperately need. We don't want to affect our schools or our police department or our essential workers by the lack of our numbers going down because we did not take 10 minutes to go and fill out a census form so that everybody in their household can in fact be counted. So I want to challenge each and every one of you today to do that. I want to challenge each and every one of you today to remember our drum major for justice, Congressman John Lewis, and what he stood for. I'm asking all of you to get into some good trouble. How do you get into some good troubles? One, fill out your census card, make sure everybody in your household is counted. Make sure your platform, your social media, you're pushing out, everybody must be counted. And then 3, go out and vote, register to vote. Thank you very much.
Thank you so much, Assemblymember Mike Gipson. That was a powerful presentation, and that was some great information. And that was a very good update on the work that you continue to do within the community, in the 64th District specifically. Our last speaker is Nikiah Hawkins, attorney and voter registration chairman for the Omega Psi Phi Fraternity Tall chapter. Nikiah is a native of Los Angeles, California, received his Bachelor of Arts degree in political science from Alabama State University, and a Juris Doctorate degree from the Thurgood Marshall School of Law, with an emphasis in government law. Nikiah has worked in the United States House of Representatives as a legislative assistant for Congresswoman Sheila Jackson Lee, out of the 18th Congressional District of Texas. Nikiah has worked for the County of Los Angeles, the State of California, and the federal judiciary. Nikiah has a passion for instructing people on voter registration, voter rights, and voter education. With that, please welcome Mr. Nikiah Hawkins.
Good afternoon. With much of what you heard today, it's readily apparent that this upcoming voting cycle is of utmost importance. And it's pivotal that your voice, my voice, our collective voices be heard. A key way to have our voices heard is through the processes of voting. Sometimes that process can seem overwhelming. Who do I vote for? What does a yes vote on this measure mean? Where do I even need to go in order to cast my vote? Well, today I'm going to briefly provide you with access to some tools necessary to make voting in the upcoming November election seamless. The first step is registering to vote. The next step is knowing when to vote, then where to vote, and finally understanding who and what we are voting for. This year's general election is going to be held the first Tuesday in November, November 3rd, 2020. The last day to register for mail-in ballots is October 19th, 2020. Now, you can register for a mail-in ballot either by going online, or you can go to a post office and obtain a registration form. In either instance, you need to make sure that that's done by October 19th. October 19th is the date that it needs to be postmarked if you're going to mail it in. And October 19th is the date that you need to actually press send from the website if you plan to register online. Now, that's not to say that after October 19th, you won't be able to vote. You can still vote after that. You just have to go to an actual polling place and do what's known as a conditional registration. But in this era of COVID-19, the preferred method is actually a mail-in ballot to avoid everyone rushing to the polls. Here in California, we have what's known as the Voters' Choice Act. So with the Voters' Choice Act, voters can go to any polling place in their county. For example, if you live in LA County, but you live in the city of Inglewood, well, you can go to a polling place in Inglewood, Carson, Compton, Long Beach, even as far north LA County as Palmdale or Lancaster. Voters' Choice Act also provides you with an opportunity to do early mail-in ballots, where you can go, early in-person ballots, where you can go and actually cast your vote early. Next slide. Next slide. So I spoke about registering to vote. I talked about knowing when to vote, where to possibly vote. Now let me tell you about understanding what you are voting for. Here in California, we have a number of propositions that are going to be on the ballot. For example, we have Proposition 14, which deals with funding stem cell and other medical research. Proposition 15 deals with funding for public schools, community colleges, and local government services. Proposition 16 deals with an amendment to affirmative action. Proposition 17 deals with voting rights amendments for people on parole. You have Proposition 18 deals with voting rights in the primary election for 17-year-olds. So give you an example. So if this proposition was to pass, then what would happen is those individuals who are 17 at the time of the primary election, but will be 18 by the time of the general election, they will be able to vote in both primary elections as well as general elections. Then we go to Proposition 20, which restricts parole for nonviolent offenders. Proposition 21, rent control on residential property. Now, this has appeared on the ballot in the past, and with the drafting of that and the use of the legalese and some of the wording, some people voted against their own interests. So I advise you all to really take a close look at what a yes vote means on that and what a no vote means on that. Again, the importance here is that you find out exactly what these propositions mean. By no means am I pushing one particular stance over the other. That's something for you to determine. Then we go look at Proposition 22, which is a change in employment classification rules for app-based transportation and delivery drivers. That's things like Uber and Lyft and Postmates. Then we'll look at Proposition 23, regulation of kidney dialysis clinics. That's one where if that was to pass, on-site physicians would be required anytime that kidney treatment is being given to patients. Proposition 24 deals with amending consumer privacy laws. And then Proposition 25 deals with the replacement of the money bail system. So next, I want to provide you with some helpful websites. Keep in mind that the links that I'm providing you here, you can find them on our website, which is the same website that you use to register for this webinar, www.tawtawchapterqs.com. So the first link I'm going to provide you with is the registertovote.ca.gov. Visiting this link, you can apply to register to vote or fill in a printable vote by mail application, find your polling place, and learn what to expect on election day. The next link is the voterguide.sos.ca.gov. There you will find the official voter information guide for the November 3rd, 2020 general election. As of today, it's not available on the site, but it will be available on the site starting September 2020. Then we have the lwvc.org. That provides a nonpartisan description of the pros and cons of the measures that are going to be on the ballot. Those are those measures that I just went over, providing you with what the subject was. You would go to a site like this to understand a description, both what a yes vote means as well as what the no vote means. Then we have the ballotpedia.org. That site there provides you with a list of measures as well as the candidates that will appear on your ballot, both at the federal level, the state level, county level, as well as the municipal level. Now, a big thing that has been going on is voter suppression. So I definitely want to provide you with a link and contact information for that. So if you feel that you've been a victim of voter suppression or you have witnessed election fraud, then the following are links, telephone numbers, and addresses that you can contact. The website is the Secretary of State's website. I'm providing you with the telephone number in English, as well as the telephone number for Spanish. There's a fax number listed there and the address as well. This is a very important election that is coming up. It's important that we get out and we make our voices heard. As I stated earlier, the preferred method is a mail-in ballot just for because of the COVID era that we're living in. But if for whatever reason you can't do that, you miss a date, don't let that be an excuse to keep you away from the polls. Go out, have your voices heard. If you have friends that need to know this information, but they weren't able to jump on this webinar, share that information with your family and friends. Most important, get out, have your voices heard. Let's put our collective voices out there and be social engineers of change. Thank you for your time.
Thank you so much, Nikiah Hawkins, for that great presentation. That was enlightening information you provided on voter education. And I hope folks actually get to the polls, go out and vote. So now we're going to turn a bit and break things up. And if we can have all of our presenters and panelists, please come back on camera and unmute yourselves as well. We're going to turn to a raffle. We want to thank all of our attendees and guests who have witnessed all of our panelists give out this valuable information. So we've pre-selected 12 random names, and we're going to go through and we're going to raffle off some gift cards for them. So the first name that we're going to call out is Denise Jefferson. You just won a $25 Amazon gift card. Hawani Mulagata, you've just won a $25 Amazon gift card. Manuel Nieto, you've just won a $25 Buffalo Wild Wings card. Robert Avery, you've just won a $25 Chipotle card. D. Coleman, you've just won a $25 Pizza Hut card. Ann Houston Sega, you've just won a $25 Applebee's card. Eldrin Jones, You've just won a $25 cheesecake card. Vanessa Hernandez, you've just won a $25 Panda Express card. Yolanda Arnold, you've just won a $25 Chili's card. Jonathan Pryor, you've just won a $25 Marshall's gift card. Lisa Campana, you've just won a $25 Target gift card. Luba Carter, you've just won a $25 Starbucks gift card. Thank you so much for all presenting and being a part of this event. It's been a really great thing that we put together, and I hope all of our guests have enjoyed the informative information that we have. And we have some time for some questions that we're going to go through from the audience. So I'll begin to address our panelists with the questions that we have. So let's see here. Question 1. I recently read an article stating that the N95 mask and those with or without air filtration systems are suitable to particulate matter entering the mouth and nose. Is this true? So let's see here. Let's take this particular question and let's go to Dr. Yonekura.
The N95 mask is typically used by hospital staff working directly with COVID-19 patients, and it provides the most protection of any of the masks.
Okay, thank you for that. Question number 2. I'm worried about my young adults out there in the streets and coming home. How do we handle that? I'm assuming that that's a potential law enforcement question. I don't really know how to phrase that better. If the questioner could rewrite that, we'll come back to that one because it seems a little choppy. Question number 3, with school closures being discussed, how would a parent go about handling child stress levels once they understand and understand that they cannot return back to school? So we'll go to Dr. Oden for that one.
Sure. So first of all, there's so many different techniques in child psychiatry and child psychology because we know how difficult it is to raise a child. We do know that emotional distress it can be very complex, and so no one expects you to navigate this by yourself. We are not designed to handle any of this crisis by ourselves. Now, as far as emotionally checking in with children, it's the safest thing is obviously to get assistance, but if you're really just trying to gauge where they're at, there are a lot of different ways in which you can maybe try to assess how your child's doing. Even the list that the image of the 10 ways to keep your brain healthy. Certain kids may describe their emotions differently, maybe by colors, maybe by rating scales. And so, there's certain resources online in which you may be able to try to search for how to, gauge depression or anxiety in a child or different mood rating scales. If you can do a search on that, you'll see a number of different diagrams and different ways in which you can, really assess how your child's doing. And you won't have to do it every day, but maybe once a week, because once again, we are in the midst of a crisis. There's inevitable trauma that's going to occur as a result of this pandemic. There's different levels of trauma, but overall, everyone's stress is going to be a bit high until this resolves. And so, checking in weekly is really a good idea to do. And once again, if you just search, rating scales for children's mood, you'll see a ton of information out there. And as long as you start doing something, it's going to help. But once you see it, if your child is actually having distress, they may present differently. They may report that their stomach hurts, or they're having problems using the bathroom, or just different behaviors. And so you may not always be able to tell how they're doing emotionally just from them saying it. But if you do notice different changes, and if you add those different rating scales and you start to notice that there's some type of decline, then you can always, seek some further assistance with that. And anyone that you talk to for assistance is going to know that it's difficult. So none of us are expecting this to be an easy process.
Good deal. Thank you so much. Sean, we got a question for you. What is the difference between having sickle cell and having sickle cell trait, and how does what you mentioned affect the person who has the trait?
Yeah, it's a great question. So just having the sickle cell trait, like I mentioned, this is a genetic disease, so it's hereditary, it's passed down. So for a child to be born with sickle cell, they need to have the trait from both parents. So you need two to make sure that that is activated and you would be born with that trait. So if you have the trait, it just means that you may be at higher risk of having a child with sickle cell anemia, but these are tests that can now be done essentially before that child is born. So that if you know you have the trait and you are pregnant, just make sure you're doing the right prenatal testing to determine whether or not your child is likely to be born with sickle cell anemia.
Okay. One other question. Are there any pre-existing health conditions that would prevent you from donating blood?
Sure. So most of them, there are some. Most of them deal with autoimmune disorders. What I recommend doing is calling 1-800-RED Cross. You can also, please feel free to share my email, Mr. Coleman. People can email me directly if they don't want to share specific health questions in the forum on the symposium. I'm happy to answer them. Just as a general broad statistic, about 40% of people are eligible to give blood. If you're in good health, you're not taking any medications for chronic illnesses, typically you're eligible to give blood. Now that may change to just daily if your iron levels or your hemoglobin's a little bit low. We'll measure that on the day of the blood drive, but it's tough to tell and just kind of give a broad yes or no, just because there's so many different factors that go into it, because we want to be as safe as possible. Good question.
Good deal. Thank you for that. Tim Gipson, we got a question for you.
Mm-hmm.
How do we keep our seniors from identity theft of not only people in the community, but in the household of those that claim to be of assistance to them?
Very good question. That happens a lot. As a matter of fact, inside the house and internally, most times that they're victimized, you're victimized by people that are close to you. So the thing that you can do is watch your accounts. Always have the number of checks that you have, pay attention to that, because they're usually taken out of sequence in your checkbook, and you won't notice until it's too late, until they've drained your account, basically. But it's sad to say that the caregivers are probably 80% of the time responsible for compromising the account of elderly. They will also get calls from unsuspecting perpetrators who will say, well, I am from maybe Water and Power, and I need to check your electrical outlets, and I need to, for some reason, get into the house. And they'll get into the house, and then they'll take documents as well at that time, and then compromise them with those documents. So all you can do is really be aware of what your documents, where your documents are, and make sure that you're paying attention to your bank accounts, and that you are notifying your bank anytime you notice any discrepancies in your balances.
Okay, good. Thank you so much for that. We have a question for Dr. Johnson. There's been a wide range of times articulated for the development of COVID-19 vaccine. What is the real expectation of a vaccine, and how can communities, especially of color, have confidence in taking it once it's developed?
That's an interesting question. I read an article recently, Dr. Fauci believing that a vaccine wouldn't be widespread until maybe middle of 2021, right? As far as confidence is concerned for the inner city communities, there's a lot of controversy about that right now. And I think that there are a lot of sides for and against that are pushing, to validate whether it's safe, unsafe, timely manner, who should be tested first. At this very moment in time, there are volunteers, right? They're seeking volunteers. So I would wait to answer that question, or even a physician to answer that question, until maybe mid-2021, where we're sure that is more widespread, and we're more confident in the results that we're seeing in the labs and the antibodies testing that are going on right now. So hopefully that answered the question.
Okay, good deal, good deal. Thank you so much. This question is for Ms. McCoy. What ways will you represent or support the Compton community as children again return to school via internet, and how effective do you think this will be?
Well, as of right now, I think the Compton Unified School District Board voted to do the virtual classrooms until further notice, and they will be requiring the teachers, I believe, to go into the classroom and actually teach virtually, so that each child will be virtually a part of the classroom. And until parents are feeling safe, I support that. Parents are really uneasy right now, the parents that I have talked to, and I happen to be a grandmother of 11. So with that, most of my grandchildren go to Compton Unified School District. And so it is a hardship for parents that work, though, because someone has to be there with them. So it's kind of a catch-22, but until we know that our children will be safe in the classroom, that's the best case scenario. And as soon as, I'm also on a panel with First 5 LA to see what we can do to assist parents who do work. So I am working to try and help and get some kind of help for parents who do go to work. But, I think right now the safest thing is to, keep them out of the classroom, because smaller children are not going to social distance. That's just a fact. They're not going to social distance, and it's going to be, and then a lot of them are in the homes with their grandparents. And so that's how it will continue to spread. So I support them homeschooling until in virtual classrooms until we can come up with something better.
Okay, thank you so much. We're going to take one more question here. And this question will go to Tim Gipson. What do you do when you are scammed online? Who do we report this to?
There's several types of scams online. I would imagine that it's a financial compromise. Federal Trade Commission would probably be the first source. Then your local law enforcement agency. You should report it to the agency where you live, because they ultimately have the responsibility for investigating crimes that occur in their area. So, and you also want to do that, because if you don't, and people says, well, they're never going to catch these people, well, you really don't know. So if you don't make the initial report, there's no opportunity to actually trace it down. And another reason you want to make the report is because if they do this multiple times to multiple people, the law enforcement agency that's responsible for it will see that, and they will actually start to investigate it, because there's multiple reports of it. And usually you'll have the same perpetrators responsible. So maybe it's a West African, maybe it's not. A lot of this is happening locally. Your information could have been compromised on the black web and sold. And there's IP addresses that are associated with every transaction. So if you report it, they can start to trace those IP addresses down. If it's something local, it may be something more appropriate for the law enforcement agency to actually investigate. And yeah, you should actually report every incident, either to law enforcement or to the Federal Trade Commission. And I think the FBI also has a medium by which you can report online as well.
All right, thank you so much for that, Tim. That was really informative. We're going to conclude our symposium at this particular juncture. I would like to thank each of our panelists, Dr. Lynn Yonekura, Dr. Sean Inoue, Dr. Thomas Oden, Assemblymember Mike Gipson, and Councilwoman Tana McCoy, and every one of our guests who have come, and especially thanks to you, Tim Gipson, as well. I'd like to thank all of our collaborators that signed up to put this event on, Options for Recovery, the Compton Alumni Chapter of Delta Sigma Theta, and I hope that all of the topics that have been brought before you are informative. We will have information where you can find the slides and the websites and links that have been mentioned on our website, and that is tawtawchapterqs.com. That is tawtawchapterqs.com. It is also where you register for this symposium, so feel free to go back there. We will have that up shortly if it's not already. You'll be able to go get the links and get some more information for you to continue your research. We hope you found it informative, and we'd like to thank you and make sure that you have a great rest of your evening. Thank you for joining us once again.
Thanks for having me.
All right. Bye-bye.
Thank you. Bye.
Thank you.
Have a blessed